Everyone, and welcome back to Atlantic Coast Aesthetics. Thank you for joining us again. And with us is Dr. Payne, founder and chief medical officer of Atlantic Coast Aesthetics. And we have a question from one of our Facebook audience members. Question is, do I need a breast lift or breast augmentation? Dr. Payne, why don't you take it away and let us know what the best course of action is.
Great. That's a very common question, and it's one we hear very often. The thing to keep in mind is a breast lift and a breast augmentation do different things, and the right one depends mostly on the starting anatomy and whatever the goal, whatever your goal is for the procedure. People that have no breast drooping and just want to be larger, then the answer is, of course, to do a breast augmentation. It's just a question to choose where the incision is going to be placed and what size or what style implant is going to be used. For people with some degree of breast drooping, if there's only a little bit of breast drooping and the breast is to be made larger, then sometimes an implant alone can be enough to accomplish both tasks. If there's a moderate amount of drooping of the breasts or a lot of sagging of the breasts, and the goal is not to put an implant in and not to make the breast larger, then sometimes the breast can be lifted just with a rearrangement of the tissues to try to give a lift only, and varying types of scars need to be done for that. Usually for that kind of procedure, a scar has to go around the areola and then on the bottom part of the breast, and sometimes underneath the breast, depending on what the skin looks like. People that want to be lifted and larger will require an implant and then a lift. And again, the exact type of lift depends on how much skin drooping there is. If there's a lot of skin drooping, the scars are a little bit longer. And the one thing to keep in mind, if there's a lot of breast drooping and the desire is to have a large augmentation, sometimes you can't put a very big implant in at the same time you do a full breast lift. And sometimes in those cases, the patients are best advised to stage the procedures. But in most cases, with a moderate sized implant choice and a moderate degree of breast drooping or ptosis, the procedures can be combined into one procedure, which limits the recovery time and downtime for that procedure.
Well, thank you, Dr. Payne. Appreciate you answering that question. And if you have a question for Dr. Payne about cosmetic or plastic surgery procedures, please visit us at our Facebook page by using the link below. And we appreciate your time, doctor, and we'll see you next time.
You're welcome. Take care.